Hello quarantine family, Dr. Saccone bringing the latest COVID-19 update. Not too much to discuss, so it should be a quick update. As always, I'm going to show the latest curves and projections and when it's looking like the different states may start reopening. I'm going to talk about some good news on the treatment and vaccine front as well. But first things first, Dr. Andy McBride, who we interviewed last week, has made a full recovery and has returned back to work this week. His wife is almost completely healthy as well. So it's great to hear about a few of the many recoveries, but it's also great to hear that he's back out there helping everyone again. Now today, I'm not going to talk about the exact case numbers and death rates like I have before, mainly since I've been hammering home that those are only of limited value, since multiple studies continue to show that this is so much more widespread than what's being reported. So rather than going through all the statistics, I'm going to show you my curves, and then we can kind of talk through the details about expectations, reopenings, etc. And we'll talk about the United States, New Jersey, Pennsylvania, and Kentucky. So, as of today, April 30th, here are the U.S. new cases. As you can see, we're definitely on a downward trajectory. There's a leveling off towards middle of May, and exactly when it's hard to predict, but that's around the time that many of the states are going to start relaxing some of their restrictions, and when that happens, we'll see some areas reporting some new cases. And really, this is not unexpected. But it's going to be nearly impossible to apply a standard curve model across 50 different states. So, here's the latest for New Jersey. As you can see, we too are on a downward trajectory of new cases. Now, the guidelines want a 2-week downward trajectory, which if this continues would be around May 9th, which could allow some of the restrictions to be relaxed around that time. And that's really what I've been saying for a while, middle of May. However, for everything to really open back up, guidelines are also going to want to have a new caseload down to 1 case per million per day, which would be like 8 to 9 new cases per day in New Jersey. And this is going to be really hard to predict. My model puts us close to May 20th, maybe 27th, somewhere in that realm. But with an anticipated further plateauing, maybe some sharp drops or upticks, it's going to be hard to see exactly. Now, Pennsylvania has been on a downward trajectory for more than 2 weeks. They should be able to start some soft reopening soon in selected areas. Governor Tom Wolf states that counties can begin looking at reopening once they have fewer than 50 cases per 100,000 people over a 2-week period. Now, I haven't analyzed the data on a per county basis, but I expect PA as a whole can start loosening restrictions by middle of May, and we see much more relaxed restrictions by the end of May, similar to what we see in the timeline in New Jersey. Now, Kentucky is having very erratic data, and this is likely due to the difficulty in testing and getting the results. Kentucky is an underserved area, and it's going to be difficult to organize some effective and timely testing and reporting in much of the state. And I can't say for certain if Kentucky has fully peaked yet or not, but if they're not there yet, it seems like they're close. But the downside to this is that this is going to push their trajectory out about 2 weeks longer than what we're expecting to see in New Jersey and Pennsylvania. So I expect restrictions getting loosened at the end of May and a stronger relaxing within the first 2 weeks of June. Now, when I say restrictions getting loosened, I mean that we start to open up construction, certain small businesses, maybe some dining restrictions get loosened. Just overall, just loosening that shelter-in-place guideline. When I'm talking about relaxing the restrictions, this is more extreme, where the majority, if not all businesses, can reopen, but social distancing, masks, etc. are going to remain in place. Now, remain calm though. Even if these restrictions are lightened, no one will expect the vulnerable populations to resume normal activities. It will likely be completely acceptable for you to continue to shelter in place if you feel it's necessary. It'll merely allow the healthier populations to accept some risk if they choose to. It's safe to say that I think the light at the end of the tunnel is able to be seen. We're seeing deaths, ICU bed use, and the hospitalizations continue to trend down within the state of New Jersey. There is a slight trend up in hospitalizations in South Jersey, but it's not a steep rise, and the deaths and ICU beds are decreasing. We're coming out of this, and the data clearly supports this. Now, onto the treatment front. The drug company Gilead released good data on the drug remdesivir. This is an antiviral drug that is in clinical trials, and it is available for use in hospitals. The data is promising, but it's not a cure. When we looked at the deaths in people on remdesivir versus placebo, 11% on placebo died, whereas only 8% did on remdesivir. Now, this is not the silver bullet that we've been looking for, but it's 3%. And if that were applied to the data that we have, it would have saved over 1,500 lives. But more importantly, it has been shown to decrease hospital days. This raises the hospital's capacity, and which in and of itself is going to save lives, and really that's the whole goal of flattening the curve. There's a lot of talk about vaccines. There's an ongoing trials at Oxford University. Oxford had developed a vaccine for a similar coronavirus, and because of that, it was able to streamline its efforts. If everything goes smoothly, they could have a vaccine ready as early as September. This doesn't mean that it would be available for the general population, as production, distribution, etc. are still going to be a factor, but it's promising. And President Trump has also unveiled Operation Warp Speed, which is a massive collaborative effort between the top pharmaceutical companies, different government agencies, and the military. And this is aiming to cut the production time to have an available vaccine ready in 8 months, which would target around December, early January. Now, the questions on how effective a vaccine would be, the length of immunity, etc., it's still to be seen, but we will see this information, and really any immunity will be good. It's going to be our best chance to have us get to herd immunity quickly. I'm pleased with what we're seeing overall, and you're going to see lots of different models and trending, but I'm holding with my data and my models because they've been consistently accurate over the past few months, and I'm going to continue to be unbiased and factual because facts are more important than feelings. We're getting close, my friends. Stay strong, and as always, millions of Americans' health, lives, and jobs are depending on you to continue to do your part. Take care, stay healthy, and God bless.